Care Management Onboarding Visit, APCM. Today we'll clarify exactly what APCM is, how it differs from the chronic care management work you've been doing, how to properly map diagnoses, how consent works, and what happens after you complete an APCM onboarding visit. Let's get started. APCM stands for Advanced Primary Care Management. It is a newer care management program that serves as an extra layer of proactive support for patients. The goal is to improve coordinated care, provide continuous support between doctor visits, help patients manage their health more actively, and reduce hospitalizations. Unlike traditional CCM, APCM gives us more flexibility in who we can bring into the program. CCM requires patients to have 2 or more chronic conditions that have lasted or are expected to last at least 12 months, with significant risk of hospitalization or decline. You must spend a minimum of 20 minutes per month on chart review and care coordination. A PCM changes this in 2 important ways. First, a patient only needs 1 chronic condition lasting 12 months or more to qualify. Second, there is no minimum time requirement. The care coordinator can spend 5 minutes or 30 minutes depending on the complexity of the patient. We are not required to track or demonstrate time spent. Because APCM is a bundled payment, there is an important rule. If a patient is enrolled in APCM, the practice cannot bill CCM or PCM separately for that patient. APCM is designed to cover the primary care management component in one payment. However, you can still perform behavioral health integration, BHI, alongside APCM, because mental health is considered separate from the medical diagnosis management covered under APCM. APCM has 3 billing levels based on patient complexity. G0556, Level 1, is for patients with 1 or fewer chronic conditions. G0557, Level 2, is for patients with 2 or more chronic conditions. G0558, Level 3, is for qualified Medicare beneficiaries who have 2 or more chronic conditions and meet the risk criteria. The level is determined by the number and complexity of conditions, not by time spent. One of the most common questions we receive is how to handle qualifying diagnoses and program mapping. Here's the logic. If a patient has exactly 2 diagnoses, CCM takes priority. We do not duplicate the same diagnoses across CCM and PCM. If a patient has only 1 diagnosis, it should generally go to APCM if the facility is participating in the program. PCM should only be used when the diagnosis is specialty-specific and unstable. For example, uncontrolled heart failure under cardiology or uncontrolled diabetes under endocrinology. The system is designed to avoid duplication and prevent billing conflicts. When you perform an APCM onboarding visit, you should obtain consent specifically for APCM. Because APCM is a bundled program, you do not need to get separate consents for CCM or PCM at the same time. If the patient later moves out of APCM, we can reassess other programs. Mental health diagnoses remain separate. You should still obtain BHI, consent when clinically appropriate. After you complete the APCM onboarding visit, the process continues similarly to CCM but without the time tracking requirement. Our care coordinators perform monthly chart reviews, identify care gaps, and update the care plan. The facility receives a monthly report through our new web-based application. This portal gives facilities one unified place to see all active programs, patient-specific information, and even includes an AI chatbot, so directors of nursing can quickly ask questions like, how many patients are missing labs this quarter? Documentation quality remains extremely important. Every note you write may be read by others, including during audits or, in rare cases, in legal settings. Avoid generic language. Make sure your care plan and management notes are specific to the individual patient in front of you. The scribe team has been trained on this, but if you ever see duplication of diagnoses or unclear mapping, please flag it so we can address it quickly. Let's quickly recap the key points. A PCM allows us to serve patients with 1 or more chronic conditions. There is no time requirement. It is a bundled payment, so we cannot bill CCM or PCM at the same time. Consent should be obtained specifically for APCM. Diagnosis mapping follows clear priority rules to avoid duplication. After onboarding, monthly reviews continue through our care coordinators and the new facility portal.